Hello, today I will be teaching about GBS in the newborns. GBS stands for Group B Streptococcus. Objectives and learning outcomes. Student will learn what GBS means. Student will learn who carries GBS. Student will learn transmission and preventative measures. Student will learn signs and symptoms of GBS. Student will learn what GBS can do to the infected newborn. Student will learn medical procedures performed to the newborn. Student will learn medication and treatment to the newborn with GBS. Student will learn follow-up care for the newborn with GBS. What is Group B Streptococcus? Group B Streptococcus, which stands for GBS, is found in the rectovaginal area of the woman. This bacteria does not pose any harm to the mother who is pregnant. This picture is a figure of GBS bacteria. The GBS is antagonist with the lactobacillus and is more prominent when Candida is present. Who carries GBS? Approximately 1 in 4 pregnant women carry GBS. The leading cause of sepsis and meningitis in the newborns, according to the U.S. Centers for Disease Control and Prevention. Women carry this bacteria as mentioned in the previous slide, and it is found in the rectovaginal area. A leading cause of life-threatening perinatal infection in the United States. Group B Streptococcus is a naturally occurring bacterium found in 20 to 35% of healthy adults. It colonizes the rectum, vaginal, cervix, and urethra of 15% to 40% of pregnant women. GBS transmitted to the newborn baby. There's different ways of transmission. The bacteria can travel from the mother to the unborn fetus and can cause death of the fetus at any time of the pregnancy. Women with GBS in the rectovaginal area at the time of birth have 60% chance of transmitting it to the newborn. 1 to 2% of these infants will develop early onset of GBS. This presents at or within 24 hours of birth, but can occur through day 6. Late onset of GBS occurs at ages 4 to 5 weeks. This bacteria can also travel through maternal milk, and this causes the late onset of GBS. The late onset of GBS can be until 6 months or further. Preventative measures. Pregnant women are screened at 35 to 37 weeks of pregnancy to determine GBS status. If pregnant mother tests positive for GBS, she must have IV antibiotics during labor. If the mother's urine culture during pregnancy is colonized with GBS, then mother must receive IV antibiotics during labor. So usually the doctors will do a urinalysis in the beginning of pregnancy, usually around 10 weeks, and this will determine if there's any GBS bacteria in their urine. If there is, they should receive oral antibiotics at that time, and they should receive IV antibiotics during labor. Antibiotics, doctors most commonly prescribe a type of antibiotic called beta-lactams, which includes penicillin and ampicillin. In order for the antibiotic to be effective, the patient must have had at least 4 hours of antibiotic during labor. Signs and symptoms of GBS in the newborn. So there are many symptoms for GBS. When the baby has acquired GBS, it can present with any of these symptoms. The first one says high-pitched crying, shrill, moaning, or whimpering, inconsolable crying, constant grunting or moaning as if constipated or in distress, fast or slow, or difficulty breathing, blue, gray, or pale skin due to lack of oxygen, blotchy or red skin, tense or bulgy spot on top of the head, fontanelle. A sunken fontanelle can be a sign of dehydration, possibly from not eating. Infection, pus and or red skin at the base of the umbilical cord or in a puncture of the head from an internal fetal monitor. Marked irritability, projectile vomiting, reacting as if skin is tender when touched. Listless and floppy, not moving an arm or a leg, a blank stare, body stiffening and uncontrollable jerking, feeds poorly or refuses to eat, not waking for feedings, sleeping too much, difficulty being aroused, a fever, or low or unstable temperature. Hands and feet may still feel cold even with the fever. So these are all symptoms that can occur in the baby, in a newborn that has GBS. The main symptoms that I did see in newborns when they had GBS or any infection is the fever and the projectile vomiting or vomiting, feeling very poorly, not waking up to eat, and being very sleepy. Those are almost immediate ones to take the newborn to the emergency room. Those are things you want to teach your patients. When you have a mother with GBS, always teach them that these symptoms can be signs of GBS. We don't want to scare them, but we do want to let them know that this can occur even with the antibiotic. Because if it occurs and they don't treat it on time, then it can leave a lot of damages to the newborn baby. What does GBS cause in the newborn? GBS causes pneumonia, meningitis, and septicemia. Medical procedures. For the newborns less than 28 days, the physician will order blood and urine cultures, a CBC with differential, a urinalysis, lumbar puncture, chest x-ray of signs of pneumonia, an apnea monitor, stool culture of diarrhea plus blood or mucus. For an infant that is 28 days to 90 days old, CBC with differential, urinalysis, stool culture of diarrhea plus blood or mucus, chest x-ray of any signs of pneumonia, and they will consider a lumbar puncture. Because the GBS can infect infants after 6 weeks or 28 days, then the doctor, physician, or the nurse should consider for the infant to have a lumbar puncture. These medical procedures are standard care at hospitals if an infant presents with any fever. Medications. If a newborn is diagnosed with GBS, the newborn will receive IV antibiotics. GBS is sensitive to penicillin G, ampicillin, extended spectrum penicillins, first and second generation cephalosporins, and vancomycin. But penicillin G is the most narrow spectrum active agent in vitro. These antibiotics are prescribed by the physician and they will be given immediately. They will start the newborn on an antibiotics immediately. Follow-up care. Nurses are responsible for teaching mother and family of transmission of GBS. Teach patients all signs of GBS infection. Newborn can be reinfected with GBS. Teach parents to call physician with any signs or symptoms of GBS and follow up with pediatrician. As nurses, we need to teach our patients that GBS can reoccur and that they can be reinfected. So we can give them handouts of the GBS signs and symptoms. Um, the patient should follow up with their pediatrician and possibly a neurologist if they had meningitis. As a pediatric nurse, I had a patient diagnosed with GBS meningitis. He was 6 weeks old, male. The mother tested positive for GBS and was given IV antibiotics during labor. The patient was admitted with fever, not wanting to feed, and very lethargic. The physician ordered blood cultures, urine cultures, and a spinal tap. These were sent to the lab immediately. The infant was immediately put on antibiotics while waiting for the results. The infant recovered and was discharged with oral antibiotics. The mother was breastfeeding and was taught that GBS can also be transmitted through breast milk. She continued to breastfeed, which was the best for the infant. This patient was also follow up with his pediatrician, and he followed up with the neurologist. As far as in the hospital setting, we did not see anything that had affected his vision or any neurological, but he has to be assessed by a neurologist for a couple years just to check on his milestones. Thank you. Please read the following case study and answer the questions. This will not be counted as a grade. It's just so we can see how much we understand about GBS for the future quiz, and that way if you have any questions, please ask me. You will have 15 minutes to complete this, and then we will go over all the answers and any questions that you guys might have. Thank you. The quiz will be given in a week. Please study the material. It will have 8 questions and 1 extra credit for 10 points. You will have 2 hours to complete, and you cannot retake this quiz. Please make sure to study all material. All questions can be answered with this PowerPoint. Thank you.